Hello everyone, a very good day to all of you. This is Dr. Mo and with another video. Okay, today the topic is very interesting and a lot of people are complaining of that issue, which is GERD, G-E-R-D. Okay, what is GERD? What are the symptoms? Causative risk factor, treatment, and some modification to your lifestyle which will help you to reduce the problem of GERD. All right, first of all, what is GERD? GERD, it is gastroesophageal reflux disease. From the name, gastro means the stomach, esophageal means the esophagus, reflux disease. So it means the contents of the stomach will reflux or go out back to your esophagus and brings that feelings of pain and heartburn. Okay, what is the normal physiology? The normal physiology and the normal anatomy supposed to be the esophagus will connecting with our stomach through a sphincter, or we call it something like a valve. Valve means it should allow the food and the passage of drinks or anything from the mouth through the esophagus, through the sphincter, through this valve, one-way valve, into the stomach, and will be closed. Prevent the fluids, acid contents, stomach contents to go back into our esophagus, because that is bad. Why? Because the stomach lining is suited to accommodate the acid and do the digestion properly. All right, what's happening here and why it's happening? Some people, they have something we call it hiatal hernia. Hiatal hernia means there is some part of the stomach will go up into the chest, because we have something we call it the diaphragm, and through the diaphragm we have the diaphragmatic hiatus, which is an openings allow the esophagus to go from the chest into the abdomen, connecting with the stomach. Okay, so this kind of opening will be enlarged and will be dilated. So that will allow part of the stomach will go up into the chest. So this is the most common cause. What are the risk factor for the GERD? Okay, risk factor, overweight or obese. Second, if you have anything cause tightness into your abdomen or increase the intra-abdominal pressure, like chronic or continuous persistent coughing or vomiting or strain, or you do some kind of exercise which is not proper, increase the intra-abdominal strain pressure, which will push the stomach and the acids to go up and cause that problem. Okay. What are the symptoms of the GERD? The most common symptom of GERD or the gastroesophageal reflux disease is the feeling of the acid or the heartburn. Why? Because the acid will go up from the stomach to your esophagus and cause that burning sensation, which is sometimes causing a pain similar to an heart attack pain or heart-related illness. So you need to be careful and don't be confused, and try to ask and look for the medical advice and not simply assume this is GERD or this is heart, because actually the GERD is not related to or aggravated by an exercise, while the heart-related pain is related to exercise. When you do more exercise, you feel more pain. When you rest, you should get relief. Okay, so the main symptom is this heartburn sensation. Second, you will have also some abdominal pain. Okay, you will have some kind of difficulty in swallowing. Yes, it might be up to that level. Also, you might have some bad breath and some denture or teeth affected. You will cause the enamel layer will be affected because of the acid, because it can reach up to here to the throat. And if reach up to the throat, it can be aspirated into the lungs and cause respiratory related symptoms like coughing, persistent coughing, sinusitis, postnasal drip, sometimes lead to asthma, shortness of breath, and all these related respiratory illness. So it is really something serious. Okay, so now we're done with the symptoms. Let's go for something, we call it a life modification, in order to get some relief from this GERD. First, you need to do a modification into your meal, and you need to choose your meals properly. There are certain meals or food that cause the problem to be worse, and actually it is by a try. So if you try certain type of food and make it worse, please avoid that type of food. And the very famous type of food that cause the worsening of the symptoms of the GERD is: first, chocolate; second, spicy food; third, fatty, oily food; fourth, there are certain habits you practice while you're eating. Like, for example, you drink water or any kind of juice while you are eating. That will make it worse because it will increase the gastric or stomach fluid contents. So that will increase the pressure and will cause more reflux. Okay, what are the other types of food that causing worsening of the symptoms? Tomato, okay, because it's citric and acidic. Citrus fruit like orange, because that will cause some pain to the affected esophagus and make you feel worse. Mint, peppermint, spearmint, this one also will cause what we call dilating, or will cause weakness in the sphincter that I told you. This sphincter, by the way, that connecting between the esophagus and the stomach, we call it lower esophagus sphincter, LES, because it's located at the lower part of the esophagus connecting to the stomach. So if that valve is loosened and weakened, acid will easily climb up. What are the things that increase the GERD or make this valve loosen? Nicotine, yes. Smoking, it was found, it's one of the main reasons to cause weakness in this valve. So it will be open, allow the food contents acids to go up into your esophagus and produce all these kinds of the symptoms related to the GERD. So our advice: avoid the food that trigger and cause your GERD worse. I mentioned already the type of the food. Second, please try to avoid smoking. Try to find or consult someone to help you how to do the stop of the smoking. And we will tell you some in other videos how to stop smoking. There are some tricks. Okay. Third, avoid anything tighten on your abdomen, like a very tight belt. Something will cause more pressure and push the food. Fourth, try to adjust your meals. You eat small portions on a more times, okay? So you take 6-8 small meals rather than you take 2 or 3 large meals. Avoid drinking before or after food at least 1 hour. Bed position, try to sleep in some kind of upright position, okay? Like, for example, increase, okay? Lift up the head end of your bed by 15 to 20 cm. Don't lift up using pillows, because that will make it worse and increase the pressure on your stomach. So increase the head end of your bed, of your mattress. There are certain ways: you put some wedge, you put something, some foam, or you put some kinds of things to bring it up. Okay, not using a pillow, extra pillow. That will make it worse and will make more pressure. Okay, so the message I'm bringing in this video, please, if you suffer from any kind of heartburn, especially more than 2 times per week, you need to pay attention and you need to visit the digestive system specialist, or we call it the GIT, gastroenterologist, to check on your things, because he needs to check and needs to give you medication. All right, what are the medication that we can use? There are certain over-the-counter medication, which are the very famous as the antacids. It's either like a chewable or like a drinks, like Gaviscon and others, which will help to reduce and calm the esophagus and make you feel better. But don't use it for long. Please go and check your doctor, your family doctor, or the GIT doctor. Second, they might prescribe something we call it H2 blocker to reduce the production of the acid like cimetidine. All right. Third, something we call proton pump inhibitors like omeprazole that will reduce the proton or the protein that involved in the production of acid, so reduce the acid secretion. And there is something we call prokinetic to increase the movement of the stomach in order to increase what we call the power of emptying the stomach to reduce the food stay in your stomach, and that will help to reduce the reflux. Okay, one of the very famous prokinetic, we call it like the maxolone, metoclopramide. It will help to give some peristaltic movement to push the food faster from your stomach. Okay, so no much food left and you will have some relief, but that cannot be used for long. Please don't use it simply by yourself. Go and check with your doctor. What are the investigation your specialist might do for you? The very famous one is the endoscopy, which is a tube with a video record, so it will go from your mouth. It will go to check the esophagus, how it looks like, any redness, any inflammation, any stricture, and go to the stomach to check and can reach up to the first part of the small intestine, which is the duodenum. Okay, I don't want to scare you or frighten you, but there are some consequences of the GERD if not get treated properly. The very famous one, inflammation and ulcer in the esophagus. So your esophagus will have some kind of wound and will need to bleeding as well and very bad pain. Second, you might end up with something we call a stricture in the esophagus, because when this inflammation happened and this ulcer happened, later this is considered like a wound and will cause a scar. So like any scar happen, this will cause the thickness in the wall of your esophagus, and that will cause you, when you drink or eat, you will face some difficulty and pain. That's a serious. Third, it might lead to something we call it the Barrett esophagus. That means change in the type of the cells that normally presented in the esophagus to a different kind of cells, and that could be a precancerous, okay, and might lead to certain level, if not treated, to a cancer. So please be careful when it comes to a reflux and heartburn, and don't simply use over-the-counter by yourself, over-the-counter medication. Try to consult your family doctor, your family physician, and your specialist, and try to do the life modification I was telling you just now about the avoiding the food that trigger the things. Avoid smoking, increase the lift your bed up, okay, when you sleep, and avoid eating minimum 2 to 3 hours before sleep. That will help you. Avoid the snacks before sleep as well. Don't lay down after eating any meal minimum 2 to 3 hours. Is not allowed, because once you lay down flat, that will help the acids to climb up. So try to stay like in a sitting position or upright position after eating or drinking anything, because the gravity will help to push down the food and you will feel better. So thank you so much for watching the video. If you have any question, please ask us and we will be here to answer all your questions. Be safe and take care always.